A lot of people work past age 65. 10, 15, or 20 years ago, the best option for anyone working after age 65 was to delay Medicare enrollment and stay with their group employer health insurance. In recent years, that decision has gotten more complicated. Group employer health insurance has gotten more expensive, out-of-pocket costs have gotten a lot higher, and access to care may be limited, especially if your employer insurance is an HMO. This video will go through the things to consider in the months before you turn 65 if you're going to keep working and have the choice between Medicare and your group employer health insurance. If you want free help comparing your group insurance at work with Medicare, we do that all the time. You can call the office at 877-312-1414 or go to the links in the description for more information. Does anyone else need your group insurance? This should be the first consideration. If your spouse or any dependents need your group health insurance, it is probably best to stay with it. If others in your household have some other option for health insurance, like other employer group coverage, Affordable Care Act plans, or government-sponsored health insurance, check their costs and coverage for those before making a decision about your Medicare enrollment. Here are the things to consider when making the decision to either stay with your employer group health insurance or switch to Medicare when you become eligible near your 65th birthday. Access to care. Virtually all employer group health plans have doctor networks and restrictions like prior authorization and step therapy. These are not new or unique to Medicare insurance. Here are the questions you need to answer about your access to care through your work insurance to be able to compare it to Medicare. Is your current insurance through work an HMO or a PPO plan? Are you able to see the doctors you want to see? And are you able to use the medical facilities and hospitals that are your first choice? Do you have to deal with prior authorizations or other restrictions when accessing medical care through your group plan? How does that compare to Medicare? It depends on what type of Medicare coverage you choose. If you have original Medicare Parts A and B and a Medigap plan, also known as a Medicare supplement, you can see any doctor and use any facility or hospital in the country that accepts Medicare. With a Medigap plan, your medications are covered under a separate standalone Medicare Part D prescription drug plan. Check all of your medications to see if any have restrictions or are not covered under Medicare Part D. Finding out that medications that are covered by group insurance but are not covered under Medicare Part D is an issue that people run into when comparing their group health insurance from work with Medicare. You can't assume that drugs covered by your work insurance are also covered by Medicare. If you choose a Medicare Advantage plan, you will have a provider network similar to your work insurance. Medicare Advantage plans are also, for the most part, HMOs or PPOs. So if you are looking at these, make sure your current doctors and any other doctors, hospitals, or facilities you want to use in the future are included in the Medicare Advantage plan network. Also, since most Medicare Advantage plans include Medicare Part D prescription drug benefits, check your prescription medications to see if there are any restrictions and to make sure they are covered. Don't forget about your dentist and eye doctor. No matter what kind of Medicare coverage you choose, you will have to deal with dental and vision provider networks. If it's important to you to keep your current dentist and eye doctor, this is one more thing that you need to check. For a more in-depth look at a comparison between Medicare Advantage and Medigap or Medicare supplement plans, please see the video linked above. Costs. For a lot of people, the question of cost is most important. So here's how to see how your group insurance stacks up to Medicare coverage for your finances. Here are the questions you need to answer. What is your group plan's monthly premium? This is the amount that you pay or have deducted from your paycheck to be in the group insurance plan. What is your group plan's annual deductible? This is the amount that you pay for your medical care before the insurance begins paying anything. What is the annual maximum out-of-pocket risk? This will be shown on your policy documents. Keep in mind, this number includes what you pay for medical care, but does not include the premiums that you pay every month to have the insurance. How much do you pay for your medications? For this, it's best to figure out what each medication costs you for a calendar year. Keep your drug costs separate from your health costs. This makes for easier comparison with Medicare Part D estimates. Look at your medical bills for the past few years, assuming those were typical health years for you. How much did you spend in total while on your group health insurance through work? After you know your group health insurance costs and risks, you need to compare those to Medicare. Here are Medicare costs. In 2024, the Medicare Part B premium is $174.70 per month for most people. This amount is income dependent, so if you are high income, you could pay more. There can be an incredibly wide range in premium costs, depending on where you live and which plans you are considering. Be sure you are looking at a real total premium cost. If you're looking at Medicare Advantage plans, you are likely to only need one policy to cover everything, so that's just one potential monthly premium. If you're looking at a Medigap plan, remember you will also need a standalone Medicare Part D plan for your prescriptions, and if you want dental, vision, and hearing coverage, that would be an additional policy with an additional monthly premium cost. You can do the research on all available plans in your zip code on your own, but it is much easier to have a broker do this step for you, and we do this at no charge to you. Just like with your group plan, you need to know the deductible for whatever Medicare Advantage or Medicare Supplement plans you are considering. What is the annual maximum out-of-pocket risk? Again, to compare apples to apples with your group plan, you need to know the out-of-pocket risk for each type of Medicare plan. That means Medicare Advantage and Medigap or Medicare Supplement. Because of how Medicare Part D is set up, it's easiest for comparison to have a separate line item for drug costs to compare to your group insurance. Whether you are looking at a standalone Medicare Part D plan or Part D coverage included in a Medicare Advantage plan, your drug costs will be calculated separately from your health costs. Once you have that information collected, you can set up the costs in columns to visualize the pros and cons of each option. As you're building your comparison, I recommend putting a few different scenarios on paper. The best case, which is no or very minimal healthcare through the year. The worst case, including hospitalizations, outpatient procedures, high medication costs, etc. And also a typical healthcare year, whatever that looks like for you as an individual. In some cases, the best choice is obvious, but in many it isn't. For a lot of people, it comes down to what coverage you prefer and what you believe will work best for your healthcare at this stage of your life. Can I change my mind? When you are approaching 65, the Medicare choices can seem overwhelming. Always remember that you are not locking yourself in to one coverage option for the rest of your life. A question that people will ask is, what if my work insurance gets better? Can I leave Medicare and go back to my group plan? Now, honestly, this isn't very likely considering the direction that most group health insurance is going, but if it does, yes, you can leave Medicare and re-enroll in your group health plan during a valid enrollment period. Depending on what Medicare coverage you have, you will need a valid disenrollment period. And to disenroll from Medicare Part B, you will need to have an interview with Social Security, but it is possible. One thing to keep in mind is if you have been on Medicare Part B for more than 6 months, once you are age 65 or older, your Medicare Supplement open enrollment period has expired and you don't get another one if you return to your group health insurance and then later choose to leave that. That means when you leave your group plan a second time, you will have a guaranteed issue right to purchase some Medigap plans without having to answer health questions, but not all Medigap plans. This is not an issue for standalone Medicare Part D plans or Medicare Advantage plans. You will have a special enrollment period when you leave your group plan again to enroll in either of those. You don't have to go through any of this alone. We help people compare their work insurance to Medicare options available in their zip code all the time. If you have questions, please call the office at 877-312-1414 or reserve a free, no obligation Medicare plan consultation using the links in the description. We're here to help you understand your options and find the right health coverage for you. Have a great day.